Health Minister Dr. Zweli Mkhize has issued new advisories saying a person who has recovered from COVID-19 should wait at least 10 days from the date of a positive test before going out in public again. He says it's been proven that in mild cases, virus cultures are generally only positive for 8 to 9 days after symptom onset. Professor Marc Mendelson is an expert in infectious diseases. He joins us now from Cape Town. Professor Mendelson, good evening, and thank you so much for your time. Perhaps maybe a point of clarity there. Speak to us about what the changes in regulations are in terms of treating COVID-19 patients, especially with the knowledge that many people are going to be treating themselves at home, and organizations also need to know what exactly is at play here.
So the timing that you mentioned relates to the isolation period for people who have confirmed COVID-19. And previously, the number was, to remember, was 14. And now it's 10. So what we're saying basically is that in people who are tested but don't have any symptoms, then they can come out of isolation 10 days after their test. For those people who do have symptoms but are mild, then they can come out of isolation 10 days after their symptoms started. And then for the more severe cases, people who have COVID who require hospitalization, then generally we make the marker 10 days of isolation after they come off oxygen requirements. So, as you say, this relates really to what we're learning and we know more about now around the amount of virus that is shed from the upper airways in a form that can be transmitted. And really, 10 days is, we now know, we think it is enough for patients to de-isolate.
Let's talk about what we are learning about how people actually recover when they've been infected with COVID-19. Speak to me maybe about just some of the observations that you've been making with some of your patients, because of course people compare their experiences, and the one thing I'm noticing is that everybody has a completely different experience to the other.
Yes, that's true, and I think it's important to remember that infection with the virus that causes COVID-19 can manifest in humans in different ways. So, a large percentage, probably 30 to 50% of people who become infected will never have symptoms. And then those that do have symptoms, most of them will have mild, what we call mild infection, which, although termed mild, can be, the symptoms can be severe and people can feel extremely fatigued, muscle pains, and then there's also a sore throat and other symptoms, but then there's the much smaller number who will go on to get very severe disease or severe COVID and require hospitalization. And at that stage, it's predominantly a respiratory, an infection which affects the lungs. And so the greatest requirement when people with severe COVID come to hospital is oxygen. And we've learnt over experience internationally and through trials now that there are a number of interventions that we can do to treat people with COVID. And the duration of time that people will be sick is very variable. So particularly for the mild infections, people who are at home, some people feel better after 2 or 3 days, and others will feel bad for a week or so, and even some further will have debilitating symptoms for a prolonged period, and we're still learning what that period could be and what the potential long-term issues could be. And then in the hospitals, generally, if patients just require oxygen on our wards, they tend to stay around 6 days on average, but again, very variable in length. And then those that are really critical and require help with their breathing through mechanical ventilation on a ventilator, they may have a longer course. Although again, the median time, the most common time for being on the ventilator is around seven days or so.
Let's
But
talk, sure.
there you go.
So sorry to interject there, but maybe just a little bit about some of the patients that you've been treating and the recovery times. What is the longest that you've been dealing with so far?
So one of the great success stories that our hospital team have had was a lady who was discharged actually yesterday from the hospital, who had total time in hospitals, including ours and one of the referral hospitals, was 77 days.
Sure.
And she spent 54 of those days in the intensive care unit, 51 of those on a ventilator, having help with her breathing. And it was extremely emotional, actually. She left the hospital yesterday, got out of her wheelchair and sort of did a little dance down the corridor. So, those sort of good news stories, really important for the hospital staff. And this wasn't a patient that I was treating, but I'm very proud to be part of a very, very large team of healthcare workers, doctors, nurses, everyone involved, administrators. And we are seeing good news stories. Clearly, COVID-19 is an potentially extremely severe illness, and we have lost a number of patients, and we mourn every one of them. But similarly, the ones that survive, people that survive, are a real success, and there is hope. It's not all bad.
Sure. I'm just thinking about the amount of dedication and just patience that it requires to be able to help a patient through 77 days of ICU. That is an absolutely phenomenal story. When you look at in terms of the recovery rate, the damage that COVID-19 sometimes also has on the rest of the body. What do we know about that right now? Because there are people who recover from the virus, but then subsequently develop all sorts of other issues, health issues that they didn't have prior to contracting COVID-19.
Yeah, I think we need to be clear, actually, just to clarify a little bit about that, because clearly we're still learning. The clock is running now, and we are starting to understand with longer term follow-up across the world of patients, how long people may be symptomatic. We recognise that although, as I said, it's in the main a problem of the lungs, that the virus can affect many other organs, and we're certainly seeing more severe presentations, people becoming unwell who are diabetic. We're seeing new cases of diabetes associated with the virus. We're seeing people who present with diarrheal illnesses, so it's affecting the gut, it can affect the kidneys. But the long-term complications, really, we need to wait and see. What we're not really seeing, or in my experience, I'm not seeing at the moment, is people who survive COVID and then develop something completely different later on as a consequence of the virus. But I again say that these are early days. And just on the point about the ICU team, your previous point, absolutely. I mean, hats off to our whole ICU team and the ward teams for absolutely amazing dedication and work. And all of the hospitals around the country doing exactly the same thing.
Professor Marc Mendelson, we're going to have to leave it there for tonight. Let me thank you for being on News at Prime this evening.